EC will update us on technical details, developments since the last time we met. Then we'll take the chairman of INEC, who will brief us. After that, if there are other updates, we'll take before we bring on board your questions, and then responses will come. So this afternoon, I will invite the chairman of the Presidential Task Force to the podium to present his remarks. But before then, apologies for delaying our guests. Thank you.
Members of the Presidential Task Force, Chairman and National Commissioners of INEC, distinguished ladies and gentlemen of the press, we add my voice to apologize to the Chairman and National Commissioners of INEC. We had invited them for 4 o'clock, but because of other engagements, we were unable to get here at the appropriate time. However, I welcome you all to the national briefing by the Presidential Task Force on COVID-19 for Thursday, 10th September 2020. The PTF had not briefed the nation since its last outing at the Nnamdi Azikiwe International Airport, when we all inspected the international wing preparatory to the reopening of the airspace. I'm pleased to inform you that as part of the efforts to restart the economy, Nigeria has reopened the international airspace on 5th September, with flights allowed into Lagos and Abuja for now. Other international airports will follow in due course. The Presidential Task Force has also released the guidelines and protocols regarding the international flights, the obligations of airlines, the pre-boarding conditions and post-boarding choices available to passengers regarding arrangements and facilities for testing. Travelers are to visit the Nigeria International Travel Portal, www.nitp.ncdc.gov.ng, to register before embarking on any international travels in and outside of Nigeria. For emphasis, I wish to reiterate that all travelers arriving in Nigeria must have tested negative for COVID-19 by PCR in country of departure, reboarding, and the PCR test must have been done within 72 to 96 hours before departure. It is also important to note that passengers are required to remain in self-isolation upon arrival and undergo a mandatory COVID-19 test in a designated private laboratory by the 7th day after arrival. The Presidential Task Force is aware of and working with other partners to speedily resolve the teething challenges faced by intending travelers in accessing the portal, the cost of the test on arrival, inability to complete payment online, and consequential inability to board. We therefore apologize to everyone that had experienced these challenges using the platform. We assure all Nigerians and visitors to Nigeria that the PTF is working across multi-layer stakeholder platforms to ease the bottlenecks. Let me also assure you that the federal government is partnering with the private sector to facilitate the process of testing a week after arrival in a seamless manner. This is driven largely by 1, deployment of technology, 2, freedom to pick a certified private laboratory of choice, and 3, delivering the service at minimal cost to government. Over the past 1 week, a lot of discussion in the public space has happened around the strike action by doctors and threat by other unions in the health sector. While appreciable progress has been made in the negotiations to resolve the issues, I must underscore the fact that we are in a global public health emergency situation that has impacted negatively on all aspects of our lives, including the economy and finances of government. This has made it imperative for all citizens, irrespective of their professions, and particularly health workers, to reawaken the sense of humanity and patriotism. The health survival of our dear nation is important, and we should eschew any action that will diminish the gains made in the containment of the pandemic so far. I'm pleased to announce that Mr. President has graciously approved additional 8.9 billion naira for COVID-19 hazard allowance to all medical and health workers in the country. In addition, the procurement of personal protective equipment, PPE, for hospitals and isolation centers is in progress and will be given priority. Last week, Mr. President attended the ECOWAS Heads of States and Government meeting in Niamey, Niger Republic, on Monday, where the issues of COVID-19 were discussed extensively. As the ECOWAS champion on COVID-19, the President informed the meeting on how Nigeria is tackling the pandemic in order to flatten the curve and advance steps being taken to push a regional agenda. The Honorable Minister, when he attends the meeting later on, was in attendance and will brief you in greater details. During the intervening week, the President presided over a ministerial retreat to review the first year performance of government as it relates to the 9 priority areas. During the program, the impact of COVID-19 and the national response was exhaustively discussed. At the end of the retreat, the President sent a message of hope and appreciation to all Nigerians, and particularly to the media, for the tremendous effort made in public awareness creation in the management of the national response. He also reassured Nigerians of a renewed determination to deliver on the promises of government to the nation. As part of the efforts to promote community engagement, the PTF met with the Northern Traditional Leaders Committee on Polio and Primary Health Care, led by the Sultan of Sokoto, to discuss on how we can control community spread of coronavirus. The Royal Fathers pledged their commitment and continued support as custodians of the rich history and cultures of our people. We are working on replicating this dialogue around the country. Also today, I had the privilege of briefing the National Food Security Council on the impact of COVID-19 on agriculture and the food value chain. The impact, no doubt, has been heavy, but the government has recalibrated its strategy for mitigating the impact. Last week, we promised that the chairman of INEC would join the national briefing to unveil the plans of the Commission for the Edo and Ondo governorship elections within the COVID-19 era. I therefore welcome Professor Mahmoud Yakubu and his colleagues to the briefing. He will be available to give you information and thereafter answer your questions. I now have the pleasure to invite the representative of the DG of the Nigerian Center for Disease Control, and thereafter the national coordinator, to give us the technical updates on developments. I want to thank you for your kind attention, and Have a pleasant evening.
Good afternoon, Chairman, sir, honorable ministers, Chairman INEC. Good afternoon, ladies and gentlemen. I'll just quickly touch on what is trending now in terms of the opening of the airport, some of the challenges. I know we are aware of some challenges, and I'm sure you have also received some information about the challenges that we have been facing. But we have been working with the team to make sure that we overcome these challenges, and the chairman just mentioned some of them. And one of the major challenges is getting a QR code after payment, and this we have tried to work on by having another website where they can get into and get their QR code. And this is a safe port, that's the https:/saferport, that's SAFER ports.com/mytraveler-record. Once they go into that, they will be able to get their QR code. But of course, the Aviation Ministry, as the NCCA, has also informed all airlines that to allow passengers to come in without the QR code, and once they have the negative test result for COVID. So we're actually working on with the team. But for those that are the pre-boarding, for those that are within Nigeria, that is going out of the country, I think the national coordinator might talk more on that. But we advise that they check with the airlines and the country where they're going to, the embassies, and check for the criteria or the necessary requirements before they do that. Now, quickly going to some of the focus for today, apart from that of the opening of the airline, and that is taking responsibility. And as we all know, at the beginning of the outbreak, we knew little or nothing about the disease, but thankfully we have known a lot now, and according to this research, about 80% of people infected with the virus will actually be moderate, mild, or not even show symptoms at all. However, there are some people that will have severe complications and require intensive care. These are mainly the elderly or persons with existing health conditions, such as those with diabetes, and that may weaken their immune system. So that's why we need to take responsibility. Because even though we, as healthy people, are not showing symptoms, but there are some that are that have conditions that they might not survive it. So we need to take responsibility. So our strategy in the country is to promptly detect, isolate, and manage cases to recovery. However, this is not straightforward when there are a high number of asymptomatic cases who are not easy to detect, and they don't even know that they have it. The danger of this is the continuous and unintentional spread of the disease, particularly to vulnerable persons who may develop severe complications. In Nigeria, the age group with the highest cases of COVID are those between 31 and 40, and those are the active age group. But the age group with the highest mortality are 50 and above, and unfortunately, at least one person out of 10 of that age group might die. So when we ask that we take responsibility, it is beyond protecting ourselves, and it's also for us to protect our loved ones. We all know someone who is vulnerable, and it is beyond, and this could be our elderly parents or friends battling with one illness or the other. The truth about COVID is that it affects anyone and everyone. We cannot afford to be lax about adhering to the preventive measures. It's also possible for someone that's having underlying condition not to know. So I would like to emphasize today, particularly for our young people that are low risk and do not have symptoms, to please take responsibility. If our efforts to slow the disease in Nigeria is to be effective, we must play our own part as citizens to support the efforts by the federal and state government. If we are showing symptoms, get tested. If it is a loved one, encourage them to get tested. There's no shame in getting tested and seeking treatment. We must continue to take responsibility by using masks in public places, maintaining that physical distance from others, frequent hand washing, and other measures that we need to take. And I hope with this, I think we know that we need to love ourselves and protect ourselves and also protect our loved ones. Please, let's take responsibility. Thank you.
The Chairman of the Presidential Task Force, honorable ministers, members of the PTF, our distinguished guests, gentlemen of the press, good evening. So today I'll be talking briefly on the role of students in the safe reopening of schools. But before I do this, I would like to, first of all, just thank INEC for your support. You have been a critical partner in the COVID response. I remember when I first started, we relied heavily on you for the initial part of the pandemic response. We never called you, and you failed to respond to our requests. So we're very grateful. We also remember the memory of, you lost a staff, I believe one of your drivers, and we wish to honor his memory as well. But thank you so much, Chairman, and your team. We had a meeting today with the Northern Traditional Leaders Council with the Grand Patron, the Sultan of Sokoto, His Eminence, Mohammed Saad Abubakar, and the acting chair as well of the NTLC. We will be distributing the communique of this meeting in the coming days, but it was a very useful meeting where we looked at the role of the traditional institution in dealing with the COVID pandemic, in particular, changing the messenger, not necessarily changing the message itself, because I think the message has already been transmitted and received, but maybe the messenger needs to change. So we'll be working closely, moving on with the Committee of Traditional Rulers. We know they did an excellent job with the polio eradication, and we want to leverage on that to improve our response. In terms of the issue of international airports, as stated earlier by the chairman and my colleague, yes, we've been having problems with the travel portal. This isn't unexpected. This is a new portal, and the demand on it has been significant. We are working day and night with our partners, CACOVID, through their IT units to resolve some of these issues. For the moment, we have put aside the mandatory requirement for a QR code for people boarding flights into Nigeria. But this is a temporary solution. Eventually, we will put back this requirement. Because we've done that, I'm appealing to all travelers from outside the country to please try and go onto the portal, upload their health questionnaire, upload their COVID-19 PCR, and try to pay. If you want to clear the airport quickly, this is the best way to do it. But if you want to spend a decent period of time at the airport trying to sort this out, then you don't need to go onto the portal. You'll still be allowed to board, but it will be much, much easier for you if you have everything at hand. Yesterday, it was taken barely a minute plus for people who had everything to clear the Port Health side and move on to immigration. So I will appeal to travelers to please continue to use the portal. For those that are leaving the country, yes, we know we haven't put any guidance in terms of what is needed. This is because different countries have different requirements. It is the responsibility of travelers to check with their airline and also to check with the country they're visiting what those requirements are. But where there's a need for PCR testing, we will add additional information on our system so that passengers can know where to go and have a test done. We are aware of instances where COVID PCR tests are being presented that are fake, and we are working with the authorities to deal with this as it arises. So I'll move on to my main theme today, which is the role of students in the safe reopening of schools. So we know that state authorities are in the process of planning to reopen schools. The PTF is appealing to state governments to ensure that two things happen. One, that a risk assessment is done for all schools that are reopening, and that measures are put in place for schools to reopen safely in strict compliance to national and state guidelines. We know that Nigerian youths make up a vast majority of our population. In fact, 44% of the population, based on the 2010 figures, are below the age of 15. The median age in our country is 18 years. And that means we have a youth bulge. And the youths, this particular age group, are the ones that are actually the primary drivers of the pandemic, because they are the ones that are least likely to be symptomatic. They are the ones that are more likely to go out, socialize, and pick up the infection. Almost every family in Nigeria has a young person between the ages of 18 to 40 years. And any form of letdown or relaxation can be fatal to the people around them, especially those that belong to the vulnerable groups, those below the age, those above the age of 60, and those with pre-existing conditions such as diabetes, hypertension, etc. There's no doubt COVID-19 is still a significant threat to us all and cannot be ignored as schools plan to open. Other than an effective lockdown, it's been shown consistently that school closure is one of the most effective ways of dealing with the COVID pandemic. It definitely, almost certainly, poses a greater risk to the health and safety of the parents and the grandparents, more than that of the students, and maybe to a lesser extent to the teachers, especially if they are of advanced age. We are appealing to students, parents, and school officials to continue to take precautionary measures that can change the current position of young people as high transmitters and turn them into champions of behavior change in their sphere of influence. So what's our appeal today for students and parents? While governments are ensuring institutions take the necessary action to safeguard health, safety, and security of students across the country, students, on the other hand, also have responsibilities. These responsibilities include the non-pharmaceutical interventions that we have mentioned over and over again. They must ensure physical distancing, stay 2 meters apart within classrooms, dining halls, hallways, adhere to alternate attendance arrangements. This is a difficult period for all of us. It's not a normal period. Class attendance will most likely be different from what it used to be. So therefore, students need to comply with any change in the arrangement in terms of attendance to classes or splitting of classes, etc. For our young, we know that they have peers and they have schoolmates that they haven't seen for a long time, and we urge them to socialize with them with great caution. We are also asking parents to please explain these life-saving guidelines to their children. Ensure that your children have masks. Ensure they have access to hand sanitizers. Ensure that they maintain physical distances and they understand the importance of these measures. Importantly, ensure that they wash their hands thoroughly and safely dispose used masks upon returning home. There's no doubt the reopening of schools and learning facilities must happen at some stage. We cannot run away from this. The education of our children is important, but it must be done in a safe manner, and we must continue to take responsibility in the fight against COVID-19. Finally, the PTF remains committed to supporting students, families, and the education sector through meaningful advisories that will guarantee the safety of our communities. Thank you.
Mr. Chairman, my colleagues on the Presidential Task Force, and INEC Chairman, I understand, is around, and other guests, distinguished ladies and gentlemen. You know, everybody is a masquerade now, so you cannot really recognize. I'm sorry, Mr. Chairman, and the House once again. I had to rush down from the engagement we were having with Johesu. You know, yesterday we had an 8-hour engagement with the National Association of Resident Doctors, and today we're still on. The engagement with Johesu is still on, and we'll probably have to go back there. But when I understand that the minister may not be here, I decided to just quickly rush down. So my apology once again. Today is 10th of September 2020. The total number of positive cases recorded in Nigeria is 55,632, of a total of 433,206 samples tested. In the last 24 hours, we recorded 176 positive cases out of 2,494 samples tested. We continue to record low positivity rate, even as the number of samples tested has increased. While this is a cheering development, it will be presumptuous to conclude that the disease is reducing. This is because, as of today, not many states are testing. We shall therefore ensure that testing continues in all the states until we reach our delayed target. 10% of the positive cases are children and adolescents, with more than half of them in the age bracket of 10 to 18 years. It is therefore pertinent at this point to renew the warning of the Presidential Task Force on the reopening of schools so as not to expose our children to the risk of infection. In our meeting with the chief medical directors and medical directors of the federal teaching hospitals and medical and specialist hospitals last week, we stressed the need for them to work in synergy with the state governments to ensure a coordinated response. The meeting also provided an opportunity for the medical directors to exchange notes and share experience. Important components on COVID-19 response, such as laboratory testing, home-based care, psychosocial implications of COVID-19, challenges associated with COVID-19 case management were discussed. A critical and important outcome of the meeting was the resolve of the medical directors to complement the efforts of the state governments in the fight against the pandemic. They also stressed the need for continued routine services in order not to erode the gains we have made in other areas of health. This was also underscored in our meeting with the Honorable Commissioners of Health on Tuesday, September 1st, 2020. It is in this regard that a countrywide deployment of community volunteers to intensify contact tracing where possible and active case finding, supported by various partners that are working with us. This morning, we had the honor of addressing the meeting of the Northern Traditional Leaders Committee on Primary Healthcare Delivery with the Presidential Task Force on COVID-19. We are happy to note that the National Primary Healthcare Development Agency still enjoys the confidence and strong support of the committee. The pivotal role traditional and religious leaders played in building community trust and acceptance of the oral polio vaccine was a game changer. We therefore hope to leverage upon this advantage to halt community transmission of COVID-19. Before closing, let me just reiterate Some of you must have heard on the news a couple of days ago that the Russians supplied us with some vaccines. This is absolutely false. The Russian ambassador to Nigeria visited in company of the deputy head of mission, and all they did was to just bring a memoir, which is a kind of diplomatic communication, to let us know that, well, they are working on a vaccine, and it's still in the third phase of clinical trial. Usually you have 3 phases: the first phase, the second, and then the third, which is the last phase, where you now have several thousands of volunteers being administered with the vaccine. And that does not end the process. They still have to be followed for about a year to see whether complications or side effects will manifest. So as at this point in time, that vaccine is yet to get to that stage. So talk less of being released even in Russia. So we needed to correct that, and I think the Honorable Minister and myself, we did that to correct that impression. And even when the vaccine is ready at all, it will still be subjected to our own processes here. That's where we have NAFDAC, we have National Institute of Pharmaceutical Research and Development. The vaccines will be analyzed, will be checked for safety, and then, of course, the issue of efficacy. Because vaccines are things that you give mass application. You apply them to a large number of people. So you cannot afford to take chances. So you need to check and establish the safety. And in so doing, you want to look at the various segments of the society: children, adults, the elderly, and of course those with comorbidities. You want to be sure that is it safe to apply to those, or administer this to those who have diabetes, who have heart disease, have hypertension, liver disease, kidney disease, and all that. These are all the things that you need to check and establish before you can say this vaccine is good or not. And at the last count, we have close to about 230 vaccine candidates. And of course, this race for releasing vaccine has gone beyond human race, but rat race. Thank you very much.
Thank you, Honorable Minister of State for Health. Dear colleagues, I now invite to the podium the chairman of INEC, Professor Mahmood Yakubu, to update us on the preparations for elections.
Thank you very much. The Secretary to the Government of the Federation and Chairman of the Presidential Task Force on COVID-19, the National Coordinator, Honorable Ministers, the representative of the DG and CDC, Honorable National Commissioners, INEC, the media, ladies and gentlemen. Let me start by thanking the PTF for the invitation, not just to brief the PTF, but to brief the nation on the preparations for the forthcoming elections, in particular, the Edo governorship election holding next week. The election is on Saturday next week. The COVID-19 pandemic has disrupted virtually every facet of life worldwide, including elections. Electoral commissions are now required to organize free, fair, credible, and in the context of COVID-19, safe elections. Conduct of elections under COVID-19 is an uncharted territory. There is no history of such election in Nigeria and no global best practice that any election management body can rely upon. Similarly, as a multi-stakeholder activity, how do you conduct election and at the same time ensure the safety of voters, INEC officials, security personnel, accredited domestic and international observers, journalists, the candidates, the polling agents, and service providers such as transporters? Millions of people are involved in elections, in close proximity in the course of party primaries, electioneering campaigns, voting on election day, and collation of results and declaration of winners. How do you ensure that the health, not fiscal security, of all those involved is protected? Fortunately, the Presidential Task Force, working with the health authorities, provided a guide, the national policy. Anchored on those guidelines, INEC developed a policy specific to our mandate, covering not only the conduct of elections, but also electoral activities in general, involving voter registration, political party and election observation, and securing the electoral process. In order to protect voters, officials, and other stakeholders, the Commission identified 8 protective measures drawing from the national policy, ranging from the mandatory use of face masks, hand sanitizers, use of methylated spirit and cotton wool to clean the smart card readers after the fingerprint of each voter is read, the rules of physical distancing, the use of infrared thermometers, and procedures for handling voters and election officials showing COVID-19 symptoms. And this is the policy developed by the Commission. We have shared it widely, but we have also come with sufficient copies for all members of the PTF and all persons present in this hall. So there will be a takeaway at the end of this briefing. You will have a copy of our national policy. Drawing from the broad policies, the Commission developed a 10-point voters' code of conduct targeted specifically at the voter, giving details of the do's and don'ts at polling units on election day. For instance, it is mandatory for every voter to wear the face mask or face covering, without which the voter will not be allowed to vote. We need to emphasize that we are not asking for the kind of face mask I'm wearing, not surgical face mask, but face covering. Face covering will be sufficient for the voter to be accredited and to vote. Also, voters are required to maintain physical distancing. The Commission introduced 2 queues, one outside the polling area and the other inside the polling area. Within the inner queue, voters must maintain the mandatory 2-meter or 6-foot distance from each other. And we clearly marked this in one of the by-elections we conducted last month. I will come to that shortly. Furthermore, voters must avoid touching surfaces or leaning on walls at polling units. Furthermore, we also have clear protocols for dealing with voters who show symptoms such as high temperature, cough, sneezing, etc. In this case, they must obey all directions by officials to stop other voters from getting infected. Then there is also the procedure for evacuation in the event of emergency. In doing so, we collaborate with health officials. In Edo State, for instance, we are working with the state response team. And we were in Edo a couple of weeks ago. We had a meeting with the Permanent Secretary, Ministry of Health, who has made contact details of their officials in Benin City and in all the local government areas that we can immediately contact them on election day for emergency response. And they have all been put on alert. For the purpose of voter education, we have produced a 10-point voters' code of conduct. And this has been produced by way of a poster for voter education. And this is the poster. Voting in Safety, the INEC Voters' Code of Conduct. This has already been mass-produced with support from development partners and delivered to the states where we have elections, Edo, Ondo, and other states, because we also have by-elections in 11 states in 15 constituencies on October 31st. So in the next 1 week or so, we'll have the Edo election. 3 weeks later, we'll go to Ondo, and 3 weeks later, we'll deploy to 11 states of the Federation for elections in 15 constituencies. So we have produced the posters for voter education. We have also produced a handbill based on the Voter Code of Conduct, not only for voter education, but also for training of our officials on election duty. So it's the same poster, but it comes in a very handy form. Here it is. I've also brought sufficient copies for members of the PTF and all persons present in this hall. For inclusivity, we have produced our policy in Braille for visually impaired voters. And here it is. The pages appear blank, but the visually impaired can read the Braille guide. So the entire national policy for conducting elections in the context of COVID has also been produced in Braille for the benefit of voters who can't see and therefore can't read our flyers and our posters. I'm unsure how many people read Braille here. Otherwise, we also have a few copies that I can leave behind. We have also translated the 10-point Voters' Code of Conduct into Braille for visually impaired voters. So this is the same poster developed into a handbill, and then we developed it into a Braille for the visually impaired voters on election day. INEC is working with security personnel during elections, working with the security agencies through or under the auspices of the Interagency Consultative Committee on Election Security, ICSES. The Commission has produced and revised the Code of Conduct and Rules of Engagement for security personnel on election duty. And that also includes COVID guidelines. And this is a copy of the Code of Conduct and Rules of Engagement for security personnel on electoral duty. It's signed by the INEC chairman and the National Security Advisor as co-chairman of ICSES, but it's also signed by the Inspector General of Police as head of the lead agency in election security. And this document is available on the INEC website. It's also available on the police website, the website of the Office of the National Security Advisor, and the Department of State Services. As I said, we have copies of all these documents that we'll make available to you all. However, all these steps are in the realm of planning. We have planned well. The true test of the plan is the actual implementation. We are aware that we have two major elections in Edo and Ondo for the election of governors, as well, as I said earlier, of several by-elections. To ensure proper implementation of the policy, the Commission decided to do a test run in a by-election in the Nasarawa Central State constituency in Nasarawa State on the 8th of August 2020. This is a small constituency made up of 44 polling units and 36 voting points, making a total of 80 polling points. All the protocols enumerated in our policy were practically implemented, and the overall result is very encouraging. We are going into Edo next week, assured that we have test run our preparations for voting under the COVID-19 pandemic. And before I conclude, let me express the Commission's appreciation to the PTF. On our request, on the request of the Commission, the PTF appointed an incident manager, Dr. Hassan. I saw him somewhere. Dr. Hassan? They appointed an incident manager, Dr. Hassan, to work with the Commission. He was part of our team that visited Nasarawa for the stakeholders meeting ahead of the election we conducted on August 8th, and also gave us very useful tips on what more we should do ahead of that election. He was with us in Edo a couple of weeks ago, and by God's grace, he will be on our team on Saturday when we go back to Edo for stakeholders meeting ahead of the election on Saturday. But in addition, the PTF has recommended the deployment of infrared thermometers at PUs on election day. But as a result of budgetary constraints, INEC doesn't have all the resources. The Commission only made provision for the deployment of thermometers at collation centers, which are fewer than the numerous polling units. We have in Edo State 192 ward collation centers, 18 local government collation centers, and 1 collation center. But the polling units are more numerous. We have almost 3,000 voting locations in Edo State. We simply don't have the resources to buy the handheld thermometers and deploy them at polling units. Happily, PTF has supplied initially 100 units of the thermometers which we deployed to Nasarawa, and I'm also glad to say that they have made available 3,000 3,000 thermometers to deploy to the polling units in Edo State. I want to assure the PTF that we'll prudently use these thermometers in Edo, and we'll move the same thermometers 3 weeks later to Ondo for the governorship election on the 10th of October 2020. Finally, the Chairman PTF, I would like to appeal to all parties and candidates and all those involved in the election, whether it's in Edo, Ondo, or the by-elections, to eschew violence. In the context of COVID-19, violence will not only disrupt the elections, it will also complicate the nation's response to the health emergency. I wish to reassure the people of Edo and Ondo states of our determination to conduct free, fair, and transparent elections. Let us all work together to also ensure that the process is peaceful. Thank you, Chairman.
Thank you very much, Chairman INEC, for the reassuring position of the Commission on the forthcoming governorship elections and other elections. Now we can take the questions from the gentlemen of the press. Are we ready?
Mr. Chairman, members of the task force, my colleagues, good evening. My name is Nancy Oyedia Orom from AIT. I would like to direct all my questions to the INEC chairman. So time and time again, we've heard you say INEC is ready to conduct elections, and which has occurred in the past years. And we keep having this difficulty matching your words with action when we get to the polling centers. Now, coming to the issue at hand, which is Edo State, we see the fact that the contenders in question at the moment have been at loggerheads in recent time. Are you assuring us that INEC is ready 100% to conduct a free, fair, and credible election in Edo State? And secondly, sir, you have mentioned that you will be engaging with the security agencies in order to avert some attacks that may occur. Are you also assuring us that with this collaboration with the security agencies, we will avert any attack in Edo State and Ondo State as well? Now, in 2015, I'm aware that card readers were deployed in various parts of the country for a successful election. Now, in one of your I think I saw where you said a new technology will also be rolled out in this election, which is called ZPAD. I don't know if that is correct. And if it's correct, sir, I want to know, in 2015 election, we saw challenges using the card reader, which is a technology. So I don't know how much training you've given those that will be handling some of these technological devices in order not to have some of the challenges we had in 2015. And this technology also, does it require the internet? I want to know, if it requires the internet, what about rural villages where there is no access to the internet? I want to know what you'll be doing in those places. And also, finally, I want you to give us a clear-cut distinction of a ZPad and also a card reader. Thank you.
The Chairman, National Coordinator, members of the PTF, INEC Chairman, my colleagues. My name is Amaka Ode, I report for Arise News. And my one question to the INEC Chairman, simply, we've seen all the reports coming out of Edo State with all the threats of violence and all of that. In the forthcoming gubernatorial elections, what would actually lead to the cancellation of elections in a particular unit or a particular station? That is all I need to know from you. My next question actually is for the National Coordinator, Dr. Sani Aliyu. Well, you have actually spoken about self-isolating for everyone who's coming into Nigeria, but are they expected to self-isolate in the city where they landed, or are they allowed to travel to their communities in case they are not based in Abuja or Lagos, which are the only two airports currently allowed to bring in passengers? And if they are allowed to travel, how about their retesting? How do we intend to fix that? And also staying with you, Dr. Sani, from your last briefing, at the last PTF briefing at the international airport in Abuja here, you actually get some clarification as it concerns lifting of the ban on sporting activities. But it seemed like it's not very clear, because you spoke about non-contact sports being allowed to start, but are you saying that football and other sporting activities can resume in Nigeria? We need that clarification this evening. And also, finally, to the representative of the DG of the NCDC. Well, now that we're testing more people, especially those who are planning to travel out of Nigeria, some of them who might eventually turn out to be positive, are those results going to be added to the national tally? We need that clarification. Thank you very much.
Good afternoon, sir. The SGF, the ministers, and the INEC chairman, and all the commissioners. I welcome everybody and my colleagues. I'm going to ask some questions in English, and also I'm going to ask in Yoruba. Just only one for my Minister of Affairs. Well, INEC chairman, sir, there are some questions that just came to me just now. They sent it to me on my WhatsApp, and they're like, Edo State election especially. They mentioned a name. They said Mr. Mustafa Liki. There's an issue on that name. That how are you people going to guide against this so that at least that election will be credible, fair, and transparent. Also, they also mentioned the area of employing ad hoc staff. That are you people really not so partial in bringing people up? And what training have you been doing for them, especially in this area of COVID-19 issue? Then another advice that we have for INEC is that when we're talking about Nigeria, we have a lot of tribes, languages. We are not basically English-speaking country. There are some other languages, 3 most important indigenous languages. And with all this awareness, all these things that you are putting together, I think the 3 indigenous languages are also very, very important because we are talking about the grassroots. The grassroots. And most people, like the market women, most of them cannot read. And they are the people that will be going out to go and vote. So I'm just advising, maybe you can put it together in these 3 indigenous languages for the grassroots. It may be very late for Edo and Ondo State and for other by-election that is coming, but there are some other elections coming up. I think we can put that into it. Then my minister, sir, Minister of Health, Senator Mamora, sir, you just mentioned to us, now I'm going to ask in Yoruba, ẹ má gbàgbé orúkọ mi ní Abíọ́dún Pópóọlá. Ẹ ṣàlàyé fún wa wípé ẹ ṣẹ̀ṣẹ̀ ṣe ìpàdé tó ń pẹ̀lú àwọn ẹgbẹ́ èyí tó rí sí àwọn tó jẹ́ pé wọ́n ń tọ́jú àwọn tí wọ́n wà ní ipò àìlera, àwọn dókítà. Ẹ jọ̀ọ́ ẹ bá wa sọ ní èdè Yorùbá, àwọn ìgbìyànjú ilé-iṣẹ́ yín àti pé àwọn àṣeyọrí wo ló ti jáde nípasẹ̀ ìpàdé tí ẹ ṣe yìí. Thank you very much, sir.
Good evening, all. Rachel Abuja from the News Agency of Nigeria. My first question is for the SGF. Sir, the instance on authorities to ensure safety guidelines and protocols at entry points for international travel of our airports and is now established religiously and it's implemented, which is commendable. However, we all know that Nigeria is largely porous because of our land. Sir, how do we ensure that the tight safety measures put in place at the airport also get instituted at our land borders and our major parks as this regards interstate movement? Thank you, sir. My next question is for the coordinator. Sir, there's been concern over the true state of the pandemic in Nigeria. About 70% of activities like surveillance, contact tracing, testing, treatment, and general data are from Lagos, FCT, Plateau State, and Edo State, while the remaining states combined to give 30%, yet activities and data generated is used to describe the situation of the country in responding to the pandemic. Nigerians would like to know how scientific this is at the moment. My next question is for the NCDC representative. Since the beginning of the response, we have been notified repeatedly that the 2 major milestones to manage the case burdens are the opening of airports and schools. We have done the formal. What are plans to ensure that the latter is well managed and that any spike in case is well managed too? Thank you. And my last question, sir, is for the INEC chairman. Sir, will the commission or is the commission contemplating heavy fine or other positive measures on parties that will be violating the COVID-19 safety protocols? Thank you.
Good evening, the chairman and members of the PTF. My name is Mitaire Ikben. I report for the NTA. I have a short and simple question for the INEC chairman. Sir, if there are clear breaches of COVID-19 protocols during elections conducted during this pandemic, will such breaches affect the validity of votes cast during the election? And for For the national coordinator of the PTF, on one hand, the PTF has said that mass gatherings are limited to 50 persons, especially in enclosed spaces. And on the other hand, the PTF has said that amusement parks, event centers are to operate at half capacity. I know a lot of event centers in Abuja and even in other states of the Federation that have capacity for, say, 1,000. And if they operate at half, that will be 500. Is that what the PTF wants? Or will the PTF abrogate its restriction of mass gatherings to 50 persons? Thank you.
Good evening, members of the PTF. My name is Juliana Taiwo Baloyan of the Sun newspapers. First question goes to the coordinator. Please, has the protocol on funeral rites been reviewed? If yes, can we know them for the benefit of those that want to bury the dead? Follow up to my colleague's question on return of contact sports or the resumption of contact sports. Is the PTF considering allowing limited number of fans into stadium, like 30 to 50% capacity? For our next chairman, please. COVID has shown that this is the time to embrace electronic voting going forward. How soon do you recommend that Nigeria embraces e-voting? Thank you, sir.
Good evening, the SGF, honorable ministers, INEC, chairman, and my colleagues. My name is Rahila Lassa. I report for Voice of Nigeria. My first question is for the INEC chairman. I want to know the format INEC is using for the Edo and Ondo elections. Will people be allowed to do accreditation, then go back home and come later for the elections, or it's going to be done simultaneously? And then secondly, when you are giving the guidelines for the elections, you said people are not supposed to use face masks, they are supposed to use face coverings. What do you mean by face covering? What's your definition of face covering? Is it the face shield, or you have what you call the face covering? Then for the national coordinator, still on funerals, a report just reaching me from Rivers says that the state governor is not, or state government is not allowing people at funeral to exceed 50, and people have been complaining. So I want to know, is that the max? Is 50 the max, or it has been reviewed? Thank you.
Okay, we have taken all the questions, and they've been directed at the Honorable Minister of State for Health, the DG NCDC, the National Coordinator, and the INEC Chairman. Finally, the Chairman of the PTF will come up to the podium to round it up. So we'll begin in this order. The Honorable Minister of State for Health, followed by the DG NCDC, the National Coordinator, before we take the INEC Chairman. So, Honorable Minister of State.
Thank you very much. Mr. Chairman, my colleagues, distinguished ladies and gentlemen, ìbéèrè tí ó wá láti arábìnrin Abiodun Popoola láti ilé-iṣẹ́ Voice of Nigeria ni wípé kí ni àbájáde àwọn ìpàdé tí a ṣe pẹ̀lú àwọn dókítà tí wọ́n daṣẹ́lẹ̀ àti èyí tí à ń ṣe lọ́wọ́. Fún àwọn dókítà tí wọ́n daṣẹ́lẹ̀ ní láti ọjọ́ Monday, àwọn tí à ń pè ní National Association of Resident Doctors, àwọn dókítà tí wọ́n tún kọ́ṣẹ́ mọṣẹ́. A dúpẹ́ pé a ti bára wa sọ òótọ́ ọ̀rọ̀ ní àná, and a dẹ̀ ní ìdánilójú wípé ìdáṣẹ́sílẹ̀ yẹn ó máa dópin ní lẹ́nìí, nítorí pé a jẹ́ kí wọ́n mọ̀ wípé tí dókítà bí gbogbo àwọn tó ń ṣe iṣẹ́ ìwòsàn, a jẹ́ kí wọ́n mọ̀ wípé tí wọ́n bá daṣẹ́ sílẹ̀, kò ń ṣe ìjọba ni wọ́n ń bájà, àwọn aláìsàn ni wọ́n ń bájà, nítorí pé àwọn gan ni ó kàn. A dẹ̀ jẹ́ kí wọ́n mọ̀ yìí pé Yorùbá máa ń sọ wípé ẹ̀mí ò lárọ̀, that is, you cannot replace. When someone is dead, that person is dead. So, pé kí wọ́n mọ̀ yìí pé kò ń ṣe nǹkan tó lẹ́tọ̀ọ́, pàápàá jùlọ fún àwọn dókítà, nítorí pé kété tí a bá ti parí ẹ̀kọ́ wa ni a máa ń búra, wọ́n máa ń ṣe ìbúra fún wa tí a fi máa sọ wípé bí a ṣe máa tọ́jú àwọn aláìsàn, òun ló máa jẹ́ nǹkan tó ṣe pàtàkì jù fún wa. A dẹ̀ dúpẹ́ wípé àwọn náà rí nǹkan tí à ń sọ. Bí ó bá tẹ̀ jẹ́ wípé àwọn kan wà tí wọ́n fẹ́ tí wọ́n tí ì rí, àsìkò tá a wà yìí kì í ṣe àsìkò tí wọ́n ní láti sọ wípé àwọn ń daṣẹ́ sílẹ̀. Àwọn náà dẹ̀ rí nǹkan tá à ń sọ. Gẹ́gẹ́ bí àwa náà tí ẹ ní àǹfààní láti wà nínú ìjọba, à ń jẹ́ kí a fi yé wọn wípé àwọn nǹkan tó bá dàbí ẹ̀tọ́ wọn ó di dandan pé kí a ṣe. A lè jẹ́ kí wọ́n mọ̀ yìí pé ìjọba tó wà lóde ń ṣe ìjọba tí aláṣẹ àgbà pátápátá Muhammadu Buhari wà. Oye tí a ti san fún àwọn òṣìṣẹ́ ìwòsàn tó ń ṣe ìwòsàn fáwọn aláìsàn, ó kù díẹ̀ kó pé 30 billion naira nípa owó tá a ti sọ fún wọn. Àwọn nǹkan míì tó dẹ̀ kù láti ṣe, a jẹ́ kí wọ́n mọ̀ yìí pé díẹ̀díẹ̀ náà ni a rí pé ètò Ọlọ́run bá gbà fún wa láti ṣe. Pàápàá jùlọ tá a mọ̀ yìí pé ọ̀rọ̀ ajé wa kò rí bákan, àmì kò rí bí ó ṣe rí tẹ́lẹ̀ nítorí COVID-19. Wọ́n dẹ̀ ti gbà, a dẹ̀ ti parí yẹn. Àwọn tí à ń bá ṣèpàdé lọ lọ́wọ́ kí n tó wá síbí báyìí, àwọn ni tá à ń pè ní jòhẹ́sù, àwọn àpapọ̀ àwọn tó ń ṣe iṣẹ́ ìwòsàn. A sì ń bá wọn sọ̀rọ̀ lọ, àti ìparí nǹkan tá à ń sọ. Ó ṣeé ṣe pé nígbà tá a bá ti parí mi báyìí, èmi láti padà síbẹ̀ láti rí i pé a parí aáwọ̀ tó dà pé ó wà ní. Àwọn yẹn ò tí ì bẹ̀rẹ̀ ìdáṣẹ́sílẹ̀, mọ̀ wọ́n fi ń yé wa wípé tí a bá ṣe àwọn nǹkan kan, àwọn ń gbèrò láti dáṣẹ́ sílẹ̀. Ní agbára Ọlọ́run, wọn ò ní dáṣẹ́ yẹn sílẹ̀, a máa bá wọn sọ̀rọ̀. Ẹ ṣé o.
Thank you for the question. I have a question on travelers, a traveler going out of the country and is tested positive. Of course, once a traveler is, anyone that is tested positive cannot be allowed to travel. So the person will not travel, and of course will go for treatment, and the data will be in our database. So all all positive cases, even those that are coming into the country, on the 7th day after the test, and if they test positive, it's in our database. Even those that are tested negative will be in our database. We capture all data, and so it will be in our database, the national database, of course, and also the states where they are they are domiciled. That is where they tested. And for the school reopening, what are we doing? We have actually some recommendations, and then there are a lot of things that we'll need to work on. There are a lot of they are planning for risk assessment to see how prepared the schools are in terms of having all those non-pharmaceutical interventions in place, and also having all the medical interventions also in place in the schools. So we're working tirelessly with the Ministry of Education. Of course, it is not only at the federal level that this will have to take place, it's at all levels, because the schools are also in the community and in local government. So the schools themselves are also working. We've planned like a kind of stakeholders meeting where we will need to engage all stakeholders that are involved in the school operation, and so that is really ongoing. And I think the Minister of Education will be able to give more information on that. Thank you.
So the chairman has asked me to answer some of his questions as well. Let me see how well I can answer them. So the first question, thank you, Amaka. You were asking about self-isolation for passengers coming into the country. Yes. So the process is you get a COVID-19 PCR test before you even board your flight. It needs to be negative. When you arrive in Nigeria, before you arrive, you go through the portal, you fill in your health questionnaire, you upload your COVID-19 PCR result, and you also pay. And you get a QR code or a barcode of some sort. You arrive at the airport. If you have all three, once you have the barcode, it means you have all three on the system. And the port health officials will ask you whether anything has changed in terms of your health questionnaire. Have you developed a fever in flight? Have you started coughing, etc.? If nothing has changed, you'll just be cleared. You proceed on to immigration. You get your passport stamped. You go home. If home is Maiduguri, you go to Maiduguri. We don't expect you to stay in Abuja or Lagos. Once you have paid, it's the responsibility of the laboratory that you have chosen to make sure that they chase you wherever you are and arrange for a sample to be collected. You don't need to come back to Lagos or Abuja. We are working very closely with the state governments to identify additional private laboratories throughout the country that can come onto the payment platform. At the moment, we have 4 states that we are looking at specifically because they have private laboratories that currently feed into the NCDC numbers. These are Kano, Edo, Imo, and Anambra. There are also an additional 2 states that might have laboratories that can come onto the payment platform, and there are only 3 criteria that a private lab needs to have in order to come onto the payment platform, onto the travel platform. One is they have to be accredited with the Medical Laboratory Science Council of Nigeria. 2, they must have obtained NCDC validation and optimization, so they must have undergone an NCDC assessment process and passed. And then the 3rd criteria is they must be accredited with the state government. By accreditation with the state government, I mean recognized, registered by the state government, and are able to feed their positive numbers into the state numbers. Once they have all 3, the state authorities will write to us and ask for those in each city matter, and the traveler will choose which lab he or she wants to have a test with. So I hope that is clear. In terms of issue of sports, yes, I am a football fan, but sadly, we have not allowed contact sports at the moment. So we've only allowed non-contact sports. So football is not included. So all those football fans, sorry, it's not yet time, but we are looking at this, and we'll continue relaxing when the time comes and it's safe to do so. The issue of policy on funerals. So, yes, we increased the number of people that can attend funerals to 50. There's also, NCDC has an interim guidelines on its website for the safe burial practices. There's also a guideline that talks about transportation of persons who are deceased and have COVID-19. And I will encourage all those interested in this to please visit the NCDC website. The issue of mass gatherings and event centers. So what we said with the last relaxation was that we were opening up particularly event centers and amusement parks that are outdoors, because outdoors is the key thing. If you are outside, because of the wind factor, etc., your risk of catching COVID is much less than if you are within an enclosed environment. When it comes to capacity, what really matters are two things. One, are the people within that environment wearing masks or not? And then two, the distance between you and the next person. If the distance between you and the next person is 2 meters or more, if they cough, the infected respiratory droplets will not reach you. Secondly, if they are wearing a mask, it's even less likely that it will reach you. So what matters, strictly speaking, is really being able to maintain that physical distancing and having a barrier protection between you and the next person. We talk about capacity, half capacity, because by reducing the capacity, if you have a room like this, where it takes 100 persons, for instance, if you go to half capacity, you will have 50 persons. If you go to half capacity, it's easier for you to maintain that distancing. But of course, we cannot be prescriptive, because there could be halls with 1,000 persons, etc. We have made exceptions to the issue of mass gatherings for offices. If it is office-related, we have not put that restriction in number. But generally speaking, if you wear masks, you maintain physical distancing, it doesn't matter how many of you are in a room, you're probably still safe. Most activities, so Rachel, most activities are from certain states. How sensitive is our data? So yes, it depends on the number of tests states do. It's one of the reasons why we keep on encouraging state governments to please continue to push for more and more testing. It's only by testing and knowing your numbers that you can know how to implement your COVID program. Lagos currently has threefold the number of positives that the second highest part of the country has, which is the FCT. FCT runs at around 5,000 plus. Lagos has about 18,000 positives. But Plateau is coming up. Why is Plateau coming up? It's because they are testing. Any state in the country testing widely will have positives. Look for it, you will find it. So Plateau are the ones that are actually doing the right thing. The Lagos numbers are coming down because they have tested widely in the past. They've been able to define their problem, and they've been able to take measures to up to 50% our target. What we said is every state should ideally test up to 1% of its population. Only FCT and Lagos have reached that sort of 50% mark. All the others are much, much lower. We know Plateau is coming up, and we'll congratulate the governor for doing the right thing. We're not congratulating them for getting more and more positive cases. No, for doing the right thing by testing and testing, because by testing, you would know whether or not you have a problem. Thank you. I've already answered it. So go to the NCDC website, interim guidelines, NCDC. You can do a Google search. You'll find all the information you need. Thank you.
Okay, thank you very much. When I was invited, I thought I was only going to speak about the conduct of elections under COVID. I didn't know that some people will see the opportunity of the presence of the INEC chairman to ask all sort of questions. But it's always our pleasure to respond to these questions. I crave your indulgence. I didn't make notes of the names of all the people that asked questions. So I will only respond to some of the questions without mentioning names. I don't have the advantage of the national coordinator who has been doing this over and over, so he's familiar with all the faces here. So Nancy, is INEC ready to conduct the elections and ready 100% to conduct elections? And she specifically referred to instances in the past when issues arose on election day, after INEC had reassured the nation that we are ready for elections. My advice is that don't take election as an event. Take election as a process. Because for many people, what happens in election day is the only thing that happens in election. And I'll give you an example. Take the case of Edo. In Edo, we released the timetable and schedule of activities for the election way back on the 6th of February this year, 7 months to the election. In that timetable and schedule of activities, we identified 14 critical activities to implement, from the publication of notice of the election to the election day. So far, the Commission has successfully implemented 12 out of the 14 activities on schedule. Not one activity was altered, even by 1 day. The only 2 outstanding activities are the last day of campaign, which is Thursday next week at midnight as provided by law, 24 hours to the election, then the election day proper. So when you look at this, look at it globally rather than just what happens on election day. Then you asked if I can assure Nigerians that there will be no violence in Edo and Ondo. I can only assure you the efforts that we are making to ensure that there is no violence. A couple of weeks ago, we were in Benin City. What did we go there to do? First, to speak to the officials of INEC. And I invited all the electoral officers from all the 18 local government areas to a meeting. Thereafter, I had an engagement with representatives of all the security agencies in Benin, from the police to the SS to security and civil defense, even the prison service and the fire service. We had an engagement with the state response, the COVID-19 response in Benin that I referred to in my opening statement. And then we visited His Majesty, His Royal Majesty, the Oba of Benin. At that meeting, His Majesty promised to us that he was going to invite some of the candidates in the election and speak to them on the importance of peaceful conduct. And I'm happy to say that he did. But in addition, I carried a message to His Royal Majesty from the National Peace Committee led by our respected former head of state, General Abdulsalami Abubakar. The National Peace Committee, just like INEC and every conscientious Nigerian, is also concerned about the fear of violence in elections. And the National Peace Committee is organizing the signing of a high-profile National Peace Accord in Benin on Tuesday next week. So that's why I said earlier that we'll leave for Benin this weekend. We'll hold a stakeholders meeting with all the candidates and parties. Civil society will be present, media, everybody on Monday. Then on Tuesday, we'll now witness the signing of the peace accord. Our hope is that this effort that we are making will lead to the kind of outcome that we are talking about. Continue to make effort. And I also would also like to appeal to the media and every Nigerian. There is no onlooker in this business of ensuring peaceful elections. We all have roles in our individual ways to play. Amaka Arise, you said, what will lead to the cancellation of elections in specific locations? Sorry, before Amaka, there's another question. Can I assure Nigerians that no violence? I've answered this. On the ZPAD, you specifically requested to know what the whole purpose or function of the ZPAD is. The ZPAD is an innovation introduced by the present commission to optimize the use of the smart card reader, particularly in order to achieve full biometric accreditation. The card reader at the moment uses the fingerprint. The Z-pad, we hope, is going to use the facial. That's one dimension of the use of the Z-pad. The second is what we piloted in the Nasarawa Central State Constituency by-election. By taking a picture of the EC8A, which is the result from the polling unit, and uploading it on a portal for public view, so that Nigerians can see the results of elections from polling units real time as elections are going on. We couldn't use the smart card reader to do so because the smart card reader has no camera. So these are the two functions. In Nasarawa, after test running the uploading of results, we are satisfied, and I invite all Nigerians to register to view the results on the portal. It's there. It's going to be there forever. And we are committed to deploying the same technology in all subsequent elections, including Edo next week. We'll do so. But the second dimension of the deployment of the Z-pad is what we are still working on. It's work in progress. We deployed it in 44 polling units and 36 voting points in Nasarawa Central, half of a local government. We need to do a lot more before we deploy this new technology in a major election such as governorship in Edo, in 18 local governments, not half of a local government, and in 2,600 plus polling units. So the staff of the commission are still working, as a commission we are still working on improvement until we are satisfied that the system is robust, and until we have also consulted with stakeholders on the deployment of this new technology. We wouldn't like to gamble with it in a major election. Amaka asked, what will lead to the cancellation of elections in specific locations? Simple answer: violations of specific provisions of the Electoral Act. Election is a process governed by law, and I would like to specifically refer you to sections 26 and 53 of the Electoral Act. In the event of violence or emergency, the Commission can suspend an election, provided the reason is cogent and verifiable. But we have to fix another date to conduct the election. The second provided for by Section 53 of the Electoral Act is where there is overvoting, and where the total number of registered voters in the place where the election is disrupted or where overvoting takes place can make a difference to the outcome of the election. And that leads us to the margin of lead and margin of cancellation principle. The law prohibits the Commission from making a declaration of winner until we remobilize and go back to that place where the election is disrupted, where overvoting takes place. So what will lead to cancellation of elections is the provisions of the law, nothing else. Then somebody asked about Mustafa Leki, said there's an issue, but he didn't tell us what the issue is. So since I'm unsure what the issue is, I wouldn't hazard a response because I don't know exactly what the issue is. So I can't respond where I don't know exactly what it is about. Ad hoc staff, so recruitment and training of ad hoc staff. The position of the Commission is clear and the policy is clear for the recruitment of ad hoc staff. The Commission has just a little over 16,000 staff, from the chairman, INEC, to the driver. In Edo, for instance, we are going to recruit 17,000 ad hoc staff for the election. In a general election like the 2019 election, we recruited almost 1 million young Nigerians for election duty. So we don't have the requisite staff. The Commission, inevitably, like many commissions around the world, relies on ad hoc staff. And they're in categories. We have supervisory presiding officers that we draw from federal establishments located in states. Then we have the collation and returning officers from federal tertiary institutions. And then we have those who operate at the polling units, the presiding officers and the APOs 1, 2, and 3. but the presiding officers are always youth corps members, unless we can't have the number from those that are mobilized at a particular time. And the procedure for recruitment is also very clear. It has been done before. We'll continue to adhere to these procedures. But if there are some specific issues or specific suggestions, the Commission is open to those suggestions. Voter education in indigenous languages. You mentioned the 3 major languages. The Commission has actually gone beyond that. We do in language or languages of wider communication in a particular area, because there are parts of the country you go to where you cannot even count the number of languages spoken. But probably there is a common language spoken by people in that area. So you go for a language of wider communication in the area. As a policy, we translate our materials in the local languages. But it's not just the printed materials that I demonstrated that we only use for voter education. We also engage on the local media, particularly the local radio. For instance, if you go to Edo now and tune to the FM stations, much of what you hear in Edo is about the election. And I'm sure in the next couple of weeks in Ondo as well. So we always endeavor to translate our materials for voter education into different languages. Is the Commission contemplating punitive measures on parties violating COVID-19 policy? We are only operating under the provisions of the law. So if there are specific violations that infringe on the provisions of the Electoral Act, we'll apply the provisions of the law. Otherwise, the question is not that specific for a specific response. Will breaches of COVID-19 policy invalidate the Edo election? I'm not sure actually what that question is specifically asking for. Again, it's very difficult to respond when it is not specific. Like what, if there is a commotion, or if people come without face masks, for instance? If people come without face masks, I said so in my opening statement that they wouldn't be allowed to vote. But if there are some breaches that are of security nature, the provisions of the law will apply. But if it's specific about COVID, people coming without face masks will politely turn them away. They won't be able to vote. And then in the context of COVID-19, when will Nigeria embrace e-voting? When are we going to embrace technology in elections? I have responded to this question over and over again. Nigeria has already embraced technology, but we probably don't realize the extent to which we have gone using technology. For instance, before 2010, with every election in Nigeria, there is a fresh registration of voters. Every election, voters will be registered afresh. Since 2010, with the introduction of the biometric register of voters, we only do the continuous voter registration. In other words, we are adding to the existing register, but not registering people afresh. What has made that possible is actually technology. We have imbibed it. In 2015, the Commission went a step further by introducing biometric accreditation of voters, a combination of the permanent voters card and the smart card reader. Before then, accreditation was done manually. Yes, it's not perfect, we're improving on it. But Nigeria has taken that step. Then, recently, the Commission also deepened the use of technology in the filing of nomination of candidates by political parties. No longer are these nominations submitted physically to the office of the Commission. We created a portal for Edo and Ondo governorship elections, and it was fantastic. The Commission is always turned into a marketplace on the last day for submission of nominations. When we say that the deadline is 6 p.m. on a particular day, you see so many people come in a few minutes to 6 or even after, and the whole place turns into a chaotic situation. In the case of Edo governorship election, the last day was on a particular day, I think in August or July, and then we said that they should submit online. We trained the political parties. We gave the chairman of political parties the code, and they uploaded without human interface. Why technology to deepen the electoral process? The accreditation of observers, national and international, for the Edo and Ondo governorship elections was also done online. The accreditation of the media for the elections is also done online and will continue to deepen the use of technology in elections. Now the question is, when will all this culminate in electronic voting? We have said this again and again, that this commission is committed to introducing at least electronic balloting, using machines to ballot. And we are determined to implement this new policy with the Anambra governorship election in November next year. So thereafter, when the law is amended, then we can talk about electronic transmission of result, because the law at present does not allow for the electronic transmission of result, but it allows for electronic balloting. So we'll introduce electronic balloting, hoping that by the time the law is amended, we can then go full blast to electronically transmit results. So we're almost there. It's not going to be revolutionary, it's going to be evolutionary. And you can see that we have evolved over the years. We're not static. Will people be allowed to accredit and come back for the elections? I'm sure my sister who asked this question hasn't voted since January 2016. I'm sure she hasn't. In January 2016, the commission formally replaced the system of accreditation first, and then you come and vote later with what we call the simultaneous accreditation and voting, believing that the introduction of machine-readable, chip-based PVCs, which has a handshake with the smart card reader, has obviated the need for accreditation separately, and then you come back to vote. So I encourage you, my sister, to vote next time elections come around, and you will see the wonder. We no longer accredit separately and vote. I think finally I've been asked, what is face covering? Face covering simply means face covering. You don't have to wear this kind of mask. You can use your handkerchief, you can use your head tie to cover your mouth and your nose. That is sufficient to ensure, as the health experts have been advising us, that no droplets capable of infecting somebody close to you. So a simple thing, handkerchief will do. Once you have it, you cover your mouth and nose, you vote. But if you don't have face covering and you have no face mask, there'll be no voting. I hope I've answered all the questions, and it's wonderful to be reminded of INEC's daily briefing in 2019. Thank you.
Thank you very much, Chairman INEC. I now invite the chairman of the PTF to the podium.
I just have a question to answer. I think it was Rachel that asked a question with regards to the processes and the protocols that were put at the airport, that were stricter at the airport, and enforcement is being pursued religiously. What about the porous land borders that we have? Well, even before COVID-19, our borders were shut. Enforcement has always been a major challenge, and it will continue to be because of the porous nature of our borders and because of the interdependence of the border communities. For some of us that live in communities that are around the border communities, you realize that some of our people live in Nigeria, but they have their farmlands in Cameroon. So that has constituted a major challenge even for the law enforcement agencies to be able to police our borders. And the length of our borders, we have thousands and thousands of kilometers of borders with unidentifiable routes. So enforcement in those particular areas can be a major challenge. And I know the immigration, the armed forces, the customs have been trying to see how best they can manage the borders even before COVID-19. When we decided to shut our borders to check the excessive smuggling of products, particularly rice, and also the movement across borders to deal with small arms particularly. It was a major challenge. That was one of the reasons why the president decided to shut down the borders so that we can secure our territories and also try as much as possible to protect our farmers. So it was dual purpose, secure our territory and make sure that we limit the amount of arms that were crossing across the borders, and also protect our farmers who had gone back to land to tillage the land, particularly in the areas of rice cultivation. We realized that some of our neighbors don't even eat parboiled rice, but they import hundreds and thousands of tons of rice every year, hold them up in warehouses and begin to move them across the borders. And it was having an adverse effect on our agricultural stations where you have the only ones challenge when it comes to management of borders. I believe this week has been quite eventful in terms of reviewing where we COVID-19 West African region. He had to give a report in Niger Republic on Monday, and he came back and joined us at the ministerial retreat where virtually every sector of the 9 priority areas that we looked at was impacted by COVID-19 one way or the other. So that echoes the fact that COVID-19 is real, is virulent, is dangerous, and is still spreading like wildfire. Don't be deceived with the figures you see. If we ramp up our testing, we will find. Because right now, from the 68 plus clinics or laboratories that we have established all across the country with the private ones that have been brought into the network, our testing capacity is about 15,000 a day. So if we are testing just within the range of 3,500 tests a day, we are totally underutilizing the capacity that we have to test. Even the United States that is testing about 800,000 daily, the biggest agitation there, when you listen to their medical experts, is that they are not testing enough. They ought to test more than that. With COVID-19, if you do not seek, you will not find. So it is very, very important that the subnationals begin to ramp up their tests. I know we are fatigued. We've been in this business in the last 6 months. Everybody is tired. The frontline workers are tired. Even the media people are tired of reporting. You are not as aggressive in reporting COVID-19 as you used to be. That's human nature. We've gotten to a point where we need to recalibrate, we need to reinvigorate ourselves, because any slack in this response, COVID-19 will take advantage of it. And it will continue to cause a lot of havoc. We have gotten to a point that the community transmission is being accelerated by the day. You remember we gave you a statistic some time ago telling you that out of the 774 local governments, there were only 85 local governments that had not reported a case. That was about a month ago. Probably by the time we come back to you next week or thereabout, we will tell you that all the 774 local governments have reported COVID-19 tests and confirmed cases. What that says is that the level of community transmission, it's totally all over the country. And the only way you can interrupt that community transmission is, for now, because there's no vaccine in sight. Even the trials that have been ongoing, the three most credible that we were thinking will come on to the scene probably before the end of this year. One of the front runners had to interrupt the process because of one of the persons that took voluntarily the test, the vaccine in the UK, developing a strange illness. And because of that, they had to interrupt it so that they will find out, is it safe to proceed or not? So everything about vaccine is now virtually, the trials are going on, but it's not in the manner in which we had thought vaccine will be available in the next couple of months. I still believe seriously that vaccines might be available in the context of early next year to later part of summer next year. Between 12 and 18 months has been the prediction. Before then, what do we do? The only vaccine we have in our hands is getting yourself entwined. And for no justifiable reason, why must you travel? That is why on the part of government, we have tried as much as possible to go digital in terms of all exercises, except if it is necessary. Even the Federal Executive Council operates virtually every Wednesday, the meetings, except for members of council that would have to present memos physically. Most members of cabinet stay in their offices. We have also asked that as much as possible, travels should be very restrictive, and boards of parastatals should hold Zoom meetings or use any virtual platform for their meetings. So what I'm saying in essence is that for now, we as Nigerians have the responsibility to care for ourselves and care for our loved ones. And it is very, very important that we understand that it is a collective responsibility. I've seen the recklessness with which we exercise faith. But for now, please, until the vaccine shows up, which is not likely to be before the end of this year, whatever is being said and whatever politics is being played around it, we need to remain safe. We need to protect ourselves, we need to protect our communities, we need to protect our loved ones. One of the reasons why the president decided to extend the lifespan of the PTF is because we've opened up our international airspace. People are coming from all over the world, some coming from even high burden areas, As of today, India is number 2 to the US in terms of rates of infection. They have recorded about 4-point-something million. So they are trailing behind the US quite closely. Other countries will join the queue. And people will be coming from different places, high burden areas. That's why the protocols of coming to Nigeria has now been further tightened. We want you to produce a PCR test result 72 to 96 hours before departure, that you are free. We are opening up schools. By the time the Federal Ministry of Education conclude the arrangements, schools will open. Not for exiting classes. The universities, the tertiary institutions are there. We cannot stagnate the educational development of our wards. So we have to do something. We are opening up the sectors of the economy. So far, we just have very few left. By the time we gravitate into the next stage or phase, everything